welcome to What Matters to Her Facebook video series. Today, we are going to tackle an important question that's been on the minds of some pregnant women. Joining us, as always, is our amazing obstetrician and gynecologist expert, Dr. Probhodana Ranaweera. So let's get started by hearing what question we have for him today. Doctor, many women have questions about the safety and comfort of traveling overseas while pregnant. Is it actually safe to travel overseas while being pregnant? And if so, could you please share some tips with us to ensure a comfortable and healthy journey?
Right, so it's safe, right? But depending on the patient's risk factors, we actually categorize the patient as low risk and high risk. And some of the high risk patients cannot do air travel because of various reasons. So if somebody is having a very high risk of preterm labor, who had a blood clot in the leg and all that, we sometimes, very rarely, might say don't travel, right? And usually you need a letter from your obstetrician to fly. So that's number one. But in majority of the time, you can fly, and usually most of the airlines will fly you up to 36 weeks. Now the reason that after 36 weeks we get a chance of labor, but if you go to preterm labor, then can't have. But all the staff at an airline is trained for delivery of a baby in flight, right? So that's number one. We hope that it doesn't happen, but we do a calculation, especially if we have put a surpluge, if the neck of the womb is shorter, and then those women we might say don't travel. If you are traveling, if you are planning to travel by air, then there are certain things that you have to do. One, if you are not flying on business class, then you have to book an aisle seat. Now that is because you have to get get up and go to the toilet quite often, and then you should avoid the window seat. That's number one. And number two is if your flight is more than 4 hours, then you need to use what we call DVT prophylaxis. That is, DVTs is the main problem is when you are in long flights, there is a chance of developing blood clots in the legs. So anyway, that kind of flight has a risk of that. But then in your pregnancy, your clotting ability is high, so they have a higher risk of having that problem. And if that clot goes to your heart, that's a serious problem. So the things you can do is that drink plenty of water the night before, book an aisle seat so that you can walk to the toilet, and then drink plenty of fluids during the flight as well. And if you are during the waking time, during a flight, every 2 hours you should get up, go to at least to the loo and come back to give the muscle exercises so that the blood circulation is continuing. And if you especially have other risk factors like obesity, some other drug clotting diseases like antiphospholipid syndrome, thrombophilias and things like that, and that person should wear a stocking as well. So there are above knee DVT stockings that you have to do, and that will reduce the chance of and it's actually not only for air travel. Anyone who's traveling more than 4 hours in a car or long journeys has to stop. Like if you're traveling by car, every 4 hours you have to stop the car, get down from the car, walk for about 10 minutes and start the journey again.